Hi everyone, Dr. Emily here. Before we dive into today's eye-opening topic, please hit that like button, comment below if you've ever felt nervous about a medical appointment, and subscribe for more honest health talks. Now, let me be very clear. This video isn't about shaming anyone. It's about understanding the real impact personal hygiene has on your medical care, especially for older women. I see it all the time in my clinic. And if you don't want your doctor distracted or uncomfortable, listen closely. By the end of this video, you'll know exactly why hygiene matters more than you think, what subtle cues doctors pick up on, and practical tips to feel confident going into every appointment. So stay with me till the end. Your health depends on it. Part 1. Why hygiene matters at medical appointments. When we think about going to the doctor, most people focus on symptoms, tests, and treatments. But as a physician, I want you to understand that your overall presentation, including your personal hygiene, sends powerful signals during your appointment. This is especially true for older women. Why? Because hygiene is often one of the first things a doctor unconsciously notices, and it influences how we interpret your health and lifestyle. Think about it. Your body is a complex system, and hygiene habits reflect how well you're able to care for yourself. Good hygiene often correlates with good physical and mental health, and when that's missing, it raises red flags. When an older woman arrives looking disheveled, smelling unpleasant, or with visible skin or oral issues, it can make us wonder whether there are underlying health problems that haven't been addressed. Is there a mobility issue preventing proper self-care? Could there be cognitive decline or depression? Are there chronic illnesses that make hygiene difficult? These are not judgments. They're observations meant to guide further investigation. In fact, poor hygiene can sometimes be the first clue that something serious is going on. For example, if a woman with diabetes isn't able to maintain foot care, this raises concerns about neuropathy or infection risk. If skin is extremely dry and cracked, it might indicate dehydration or circulation problems. If there's a strong body odor, we might worry about infections, medication side effects, or even dietary factors. The bottom line is, hygiene gives doctors extra context about your health beyond what you tell us or what lab results show. On the flip side, good hygiene at a medical appointment shows that you are engaged in your care and can manage day-to-day activities well. It creates a positive impression that you are proactive and attentive to your well-being, which can encourage better communication and trust between you and your healthcare provider. That trust is vital. It affects how honest you feel comfortable being about your symptoms and how willing you are to follow medical advice. So, hygiene at medical appointments isn't just about looking nice or being polite. It's a critical piece of the health puzzle that doctors rely on to provide the best care possible. Part 2. What doctors notice. You may be surprised at just how much doctors pick up on regarding hygiene, often without even realizing it. These little details can influence how we approach your care and the questions we ask. Here are some common hygiene-related signs that doctors notice during appointments. Body odor. If a patient has noticeable body odor, it can be a warning sign. Sometimes it's as simple as poor hygiene, but other times it signals something deeper, like infections, kidney or liver issues, or medication side effects. For example, people with uncontrolled diabetes may have a distinct sweet or fruity smell. Detecting these odors helps us identify problems that might not be obvious from symptoms alone. Nail and skin condition. Dirty, cracked, or overgrown nails often catch a doctor's eye. This can point to several health concerns: poor circulation, nutritional deficiencies, or inability to perform self-care due to arthritis or mobility issues. Similarly, skin that is very dry, flaky, or bruised might suggest dehydration, poor circulation, or even abuse. Noticing these signs early can lead to interventions that prevent bigger problems down the line. Oral hygiene. Your mouth is often called the window to your health for good reason. Bad breath or obvious dental decay can be signs of infections or chronic diseases like diabetes or kidney failure. Medications can also cause dry mouth, which increases the risk of cavities and gum disease. During appointments, doctors often look inside the mouth to check for these issues because they reflect overall health status. Clothing, cleanliness, and appearance. Doctors unconsciously take note of your clothing and how clean it looks. Clothes that appear unwashed, stained, or inappropriate for the weather might suggest difficulty with daily routines, depression, or social isolation. It can also indicate financial struggles or lack of support. These factors are important because they affect your ability to follow treatment plans or attend follow-up visits. Hair condition. Hair that is greasy, matted, or unwashed signals potential problems with self-care. It might suggest physical limitations, cognitive decline, or depression. This observation can prompt a doctor to explore mental health or functional ability in more depth. Doctors aren't judging you when they notice these signs. Rather, these cues help us gather a full picture of your health, including challenges that might not come up in conversation. Being aware of what doctors notice can help you understand why hygiene matters so much in medical settings. Part 3. The impact on medical care. You might wonder how your hygiene at an appointment actually affects your medical care. The truth is, it can have a bigger impact than most people realize. First, poor hygiene can delay diagnosis or complicate examinations. For example, if there is excessive body odor or unclean skin, a doctor might have difficulty conducting a thorough physical exam or may hesitate to proceed with certain tests or treatments due to infection risk. This can slow down getting you the help you need. Second, hygiene problems can increase your risk of infections. For instance, if you have poor skin care or do not bathe regularly, harmful bacteria can accumulate, leading to skin infections or worsening existing wounds. After procedures or surgeries, good hygiene is critical to healing and preventing complications. Doctors often need to educate patients on how to improve hygiene to reduce these risks. Third, poor hygiene can affect the relationship and trust between patient and doctor. When a doctor feels a patient is not managing basic self-care, they might question the patient's ability to follow treatment plans or take medications correctly. This can lead to less aggressive treatment or more conservative approaches, which may not always be in the patient's best interest. Fourth, unfortunately, older women sometimes face social stigma and unconscious bias because of hygiene. Doctors might unconsciously assume that poor hygiene means cognitive decline or dependency, which can influence the quality of care offered. This is why it's important for patients to maintain hygiene to avoid these unfair biases and to advocate for themselves during appointments. Part 4. Practical hygiene tips for older women before appointments. Let's move from why hygiene matters to exactly what you can do to prepare for your medical visits. The good news is maintaining good hygiene doesn't have to be complicated or time-consuming. Small, consistent habits can make a huge difference in how you feel going into an appointment and how your doctor perceives your overall health. First, aim to shower or bathe regularly, ideally the day before or the morning of your appointment. This may seem obvious, but many people underestimate the power of a fresh, clean body in boosting confidence and comfort. Use a gentle, moisturizing soap to protect sensitive or dry skin. If bathing daily is difficult due to mobility or energy, even a sponge bath focusing on key areas like underarms, groin, and feet can help significantly. Next, wear clean, comfortable clothing that fits well and is easy to remove if needed. Medical appointments sometimes require exams that involve partial undressing, so avoid complicated clothing with lots of buttons or layers. Clothes don't have to be fancy or expensive, just fresh and appropriate for the weather. Wearing something you feel good in can also help your confidence, and confidence always shows. Nail care is another simple step. Trim and clean your nails regularly, as dirty or overgrown nails can be a red flag for doctors. If bending down to trim nails is hard, consider asking for help or using tools designed to assist people with limited hand mobility. A clean, neat appearance here shows you're attentive to your well-being. Don't forget oral hygiene. Brush your teeth twice daily, and if possible, use mouthwash before your appointment to freshen breath. Dry mouth is common with certain medications, so staying hydrated and possibly using saliva substitutes can help avoid dental problems that may worry your doctor. Your hair should be combed or brushed to remove tangles and improve appearance. If washing hair before an appointment is difficult, at least brush or use dry shampoo to freshen it up. Use deodorant daily to prevent body odor. If you like, a light fragrance can help you feel more put together. But avoid overpowering scents since medical offices are enclosed spaces and many patients have sensitivities. If you use incontinence products, change them fresh before your appointment. This prevents odor and discomfort, helping you feel more relaxed during the visit. All of these steps support not just the way you look, but how you feel, which matters just as much. Confidence, comfort, and cleanliness put you in the best position to have a productive and positive medical appointment. Part 5. Overcoming barriers to good hygiene. I understand that good hygiene is not always easy for everyone, especially as we age. Many older women face barriers that make maintaining personal care a challenge, and these obstacles should never be a source of shame. Physical limitations such as arthritis, joint pain, or balance problems can make tasks like bathing, nail trimming, and hair washing difficult or even dangerous. For some, cognitive decline or memory loss can lead to forgetting or neglecting hygiene routines. Mental health challenges, especially depression, can also severely affect motivation to care for oneself. If you find it hard to maintain hygiene, know that you're not alone and there are solutions. Consider asking for help from a trusted family member, friend, or caregiver. Even a little assistance with bathing or dressing can make a big difference in your comfort and cleanliness. Use adaptive tools designed to help older adults care for themselves. Long-handled sponges, no-rinse cleansing wipes, and easy grip nail clippers can reduce the effort and risk involved in hygiene tasks. Try to schedule medical appointments for times when you feel your best. If mornings are better for your energy levels, book early visits so you can shower and dress when you're most alert. If you're struggling with depression or cognitive issues, talk to your healthcare provider about it. They can recommend mental health support, social services, or home health aides to assist with daily living activities. Home health services are available in many areas and can provide professional hygiene care in the comfort of your home. This support can preserve your dignity and independence while ensuring you're clean and comfortable. Remember, needing help with hygiene is nothing to be embarrassed about. Everyone deserves to feel clean and cared for, and asking for assistance is a brave and important step toward better health. Part 6. What to do if you feel embarrassed or anxious. Feeling embarrassed or anxious about personal hygiene during medical appointments is more common than you might think, and it's a feeling many older women share. It's perfectly normal to worry about being judged or misunderstood if you haven't been able to keep up with grooming as well as you'd like. But here's something important to remember. Doctors are trained professionals whose job is to care for you, not to judge you. They understand that many factors can affect hygiene and will focus on how to help you, not shame you. If you're feeling nervous, try to be honest with your doctor. You don't have to go into every detail, but simply letting them know you're facing some challenges can open the door for support and solutions tailored to your situation. Good doctors want to work with you and will appreciate your honesty. Focus on small wins rather than perfection. Even improving 1 or 2 hygiene habits can make a big difference in how you feel and how your doctor sees your health. Celebrate these steps and don't beat yourself up over occasional setbacks. If it helps, bring a trusted friend or family member to your appointment. Having support can reduce anxiety and make it easier to communicate with your healthcare provider. Lastly, practice self-compassion. Aging comes with many changes, and it's okay to acknowledge that some days are harder than others. You deserve care, dignity, and respect no matter what.